Hello friends. Impressions invariably are contaminated with patient's saliva and blood. Such fluid can contain viral and bacterial pathogens, and these microorganisms get transferred from the contaminated impressions to the dental cast. And these impressions remain viable in such gypsum materials for up to 7 days. So, all the surfaces that have been splashed or touched by human body fluids must be disinfected to prevent the cross contamination and chain of infections. So, today we are discussing about disinfecting the impressions. Optimally, impression should be decontaminated thoroughly with the chairside disinfection method immediately after removal from the patient's mouth, and PPE must be utilized. Impression should be thoroughly rinsed under running water for the removal of the saliva and the blood, which can act as a bioburden as much as possible. And two methods of disinfection has been recommended, that is spraying and immersion. So let's discuss which chemical agent can be used for which impression material. Coming on to alginate impression material. Alginate impression material is an irreversible hydrocolloid and can be disinfected with 0.5% sodium hypochlorite. Iodophorous immersion of the impression for prolonged periods will cause distortion due to the imbibition of the solution by the alginate. Coming on to agar, that is an reversible hydrocolloid, which is found to be stable when immersed in 1:10 dilution of sodium hypochlorite or iodophore solution, and recommended immersion time is for 10 minutes. Coming on to zinc oxide eugenol impressions. Impression is immersed in 2% glutaraldehyde, iodophores or chlorine compounds. Adverse effect on the zinc oxide eugenol impression have been reported for the dilution in hypochlorite for more than 16 hours. Coming on to the impression compound. Impression compound can be immersed in 1:10 dilution of sodium hypochlorite or iodophore for a specific period of time. Coming on to elastomeric impression materials, that is polysulphide and addition silicone. This can be disinfected by glutaraldehyde, iodophore or 0.5% sodium hypochlorite. And polyether can be disinfected by spraying iodophore, 0.5% sodium hypochlorite, and prolonged immersion can cause distortion. Polyether shows dimensional changes on immersion in 2% glutaraldehyde. So, coming on to the disinfection of impression trays. Impression trays can be rinsed thoroughly under running water to remove residual blood and saliva. Pre-cleaning removes additional bioburden and any adherent impression materials. Consistent with dental infection, these are semi-critical instruments. Chrome-plated and aluminium impression trays can be cleaned, packaged and heat sterilized. Single-use plastic impression trays provide a disposable alternative to heat sterilization. Coming on to disinfection of wax rings or the wax pipe or the occlusal rings, which are supposed to be known as delicate materials due to the nature of the wax, and disinfection can be done without distortion by chlorine dioxide or sodium hypochlorite spray or iodophore spray, and spray wipe spray technique can be used. Following the second spray, the wax bite can be enclosed in a sealed plastic bag for proper contact time. The bite should remain wet with disinfectant for the time recommended. So, coming on to the summary of disinfection of various materials, that is alginate, agar, zinc oxide eugenol, impression compound, polysulphide and addition silicone, and polyether impression materials are summarized here. Thanks for your valuable time. If you think the video was informative, please like, share and subscribe. For the reference for this presentation is gained from Disinfection of Dental Impressions, a current overview.